Good morning, everyone, and thank you for joining the H.C. Wainwright BioConnect 2022 conference. My name is Louis Susser, and I'm on the corporate access team at H.C. Wainwright. While we are virtual this year, we're confident we're going to be able to provide value to you with over 550 companies presenting at this conference, as well as via your interactions through one-on-one meetings. H.C. Wainwright is a full-service investment bank dedicated to providing corporate finance, strategic advisory, and related services to public and private companies across multiple sectors and regions. We have a total of 23 publishing senior analysts and over 630 companies covered across all sectors. Please visit hcwco.com for more information. From a logistics standpoint, please make sure to reference your BioConnect virtual conference online portal that provides your individual links to your meetings and all presentations. Please join us for corporate presentations and panels that will be available live and streaming on January 10th to the 13th. With that said, have a productive and enjoyable day, and I'd like to introduce our first presenter. I'd like to welcome Larry Heaton, who is the CEO of Zomedica.
Hi, I'm Larry Heaton. I'm the Chief Executive Officer of Zomedica, where we are about the business of making tomorrow's gold standard available today. Today, I'll be making what are considered to be some forward-looking statements, and so I encourage you to review the document here as it relates to those statements. At Zomedica, we are competing in the very large animal health market. It's growing at almost 10% annually, and it's expected to reach $90 billion, close to it, by 2028. Within animal health, diagnostics is the fastest growing segment, expected to reach almost $8 billion by 2027. And within diagnostics, there's a shift towards veterinarians offering more point of care diagnostic offerings. You see, over the last several years, big box retailers and online sellers have begun selling many of the products that veterinarians used to sell from their office, compromising their economics. And so vets are looking for ways to offset that loss in income, and diagnosis at the point of care is one way for them to offset that loss. At Zomedica, we're working on a number of things behind the scenes, but what we'll focus on in this presentation and what we're focused on as a company are the two unique platforms where we are currently commercializing products. These include the TRUFORMA platform, which is an in-clinic point-of-care diagnostic device and associated assays or tests that provides a razor blade model. The instrument is used to generate income from the assays. And the recently acquired ProPulse platform, which delivers shockwave therapy to historically horses and now to small animals to treat a variety of conditions. In order to commercialize these successfully, we have a very strong balance sheet. We'll provide the resources we need to build out and to maintain the sales and marketing activities necessary to grow this business, as well as to provide substantial resources to acquire additional products to add to our portfolio. To make all of this a reality, we've recruited a highly experienced and motivated management team. Some new faces, including myself. I just started as the CEO on November 1st of 2021. And also some existing faces. One noteworthy individual, Adrian Locke, was the founding CEO of PulseVet, and having grown that company over a 10-year period, joined Zomedica and is, in addition to his CEO responsibility at PulseVet, also VP General Manager of Zomedica. The areas that we're focused on are simple: the TRUFORMA platform, the ProPulse platform, and acquiring additional products. With respect to TRUFORMA, our mission is to expand the utilization, expand the installed base of clinical sites, and as we expand that base of clinical sites, assure that each of those sites is using each of the assays that we offer, and then offer more assays. With respect to ProPulse, they've been very successful in the equine market. We're looking to launch now into the small animal market, in addition to continuing to grow the equine market, as well as to grow our business overseas. And of course, we continue to look for additional products to add to our portfolio, just as we did with the ProPulse with the acquisition of PulseVet on October 1st. Let's dig into TRUFORMA. Many labs today, many vet clinics today have diagnostic, point-of-care diagnostic products in their lab. But unfortunately, not all of them provide the kind of accuracy and quality of test result that's needed to perform an accurate diagnosis. And as a result, many of these tests are still sent out to reference labs. At TRUFORMA, it changes the paradigm, because not only does the TRUFORMA instrument provide the results in minutes, but because of the unique and proprietary technology, which we'll talk about in a minute, it provides it to the same level of accuracy as those same reference labs to which the sample would otherwise be sent by the vet. So now, for specific assays, not only do they get the result in minutes, but they get a highly accurate result, which allows for earlier diagnosis. Earlier diagnosis enables onset of therapy sooner. Onset of therapy sooner provides for better patient outcomes, not only for the pets, but also for higher customer satisfaction by the pet parents. And all of this is profitable for the veterinarian. The technology that's utilized is based on bulk acoustic wave technology that was developed and commercialized by Qorvo in the telecom and aerospace markets, and recently by Qorvo Biotechnologies in the human market. In fact, they got FDA emergency use authorization for COVID testing last year using essentially the same instrument that we commercialize as TRUFORMA. Of course, it's applied differently for humans. This technology provides the basis for the highly accurate reference lab quality results that the device produces, and is protected by a broad raft of intellectual property held by Qorvo. And we have the exclusive license to this technology for the veterinary market worldwide. Of course, the real opportunity here is in the assays themselves. These are the blades in the razor and blade scenario. Today, we offer 3 assays that are currently directed at diagnosing certain adrenal and thyroid issues that dogs and cats encounter. We're working with our development partner to bring to market additional assays to round out the panels for adrenal and thyroid disease, and also to expand the cortisol assay into the equine market. Beyond that, our partners are also working on developing assays for non-infectious GI disease. There is no shortage of opportunities for us to continue to expand the array of assays that are available, that we will make available to customers, both in specific targets that are already known and also potential disease states that would benefit from a highly accurate reference lab quality in-house diagnostic that can be performed in minutes by the TRUFORMA device. Our commercial strategy is pretty straightforward. We want to grow a very large installed base continuously over time, assure that each customer is utilizing the assays that we produce currently, and that they're ready to adopt new assays and begin using those as we develop and launch them into the market. In order to facilitate this, we view the capital equipment, the instrument, as sort of a customer acquisition cost. We've developed and launched a customer appreciation program, which places the instrument into the clinic with no upfront capital required by the veterinarian. This facilitates getting the instrument into sites and will lay the groundwork for easy introduction of new assays as they become available. When you think about it, each new assay is essentially a new product, and brings with it a new revenue stream. And yet these new products, the new assays, will have no additional customer acquisition cost, will have no additional training required, and will add no additional service burden to the sales rep that's covering that territory. And so this strategy, customer appreciation program, to get in the razor and then drive the sales of the blades, is one that we believe will provide a very significant foundation for rapid uptake of new products as they're launched in the future. And of course, there's no shortage of opportunities. There's over 35,000 clinics in the United States that currently have some sort of in-house diagnostic. Another 23,000 have not yet made that move, but represent future opportunity. And of course, there are even more, 50,000 or so, outside the United States, for a total of over 100,000 clinics, which are potential customers for this particular product. To understand the revenue implication of that, it's simply however many clinics have adopted the technology and have the instrument in place, times the number of assays that they may run on a monthly basis, times the average sale price of those assays, which currently runs from around $25 to around $45 in the United States. So we have a significant ongoing opportunity for us to penetrate. To do that, we're expanding our sales and marketing organization. We believe that multiple sales channels will best serve the interests of the company and the veterinarian customers that we call on. We've developed an inside sales team, super important in the age of COVID and the pandemic, because with this team, we've been able to remotely install and remotely train veterinarians' offices. And we believe that this inside sales team will be the key as we develop and launch new assays, the key to adding those to existing customers without the need to employ or to engage the time of the relatively more expensive field sales organization. We have a field sales organization that is 18 strong. It consists of field sales reps and their managers, as well as professional services veterinarians. These vets who have come to work for Zomedica are not only able to offer CME or continuing education approved credits by giving talks about the disease states and how they, TRUFORMA can facilitate diagnosis of them, but they're also available on a 24/7 basis to answer any clinical questions that vets may encounter as they utilize any of Zomedica products. And then a recent addition to this sales organization is the PulseVet sales team, which joined the company on October 1st when we acquired PulseVet. To support this sales effort, we're building a marketing organization as well. We believe that a professional marketing team that can engage not only veterinarians, but also pet parents as we introduce therapeutic products through all the different avenues available to marketeers today is going to be incredibly important as we move forward, especially in this time of COVID, where access is sometimes hard to come by. To this end, we've hired a vice president of marketing who will be joining the company in early February. Now let's shift gears to PulseVet. PulseVet produces the ProPulse electrohydraulic shockwave therapy that has been used historically for equine use and by early adopters in the small animal market. We acquired PulseVet on October 1st. They've got around 1,500 systems that are in use, about 3/4 of them in the United States, and the rest establishing a nice foundation of business outside the US, with a subsidiary organization in Switzerland and another subsidiary organization in Japan and a market presence in South America. They also have a razor blade model. The generator that produces the shockwave costs around $30,000 for vets to acquire, but it utilizes handpieces that are called trodes. Each trode comes new, preloaded with around 50 treatments. Once these treatments are exhausted by the vet, they send the trode back and we send them a replacement trode with 50 more treatments, and we charge them an additional $2,000 per trode refurbishment. They've been doing very nicely at PulseVet over the last 10 years or so, building revenue sequentially each year. And they did especially well in 2021. In the first 3 quarters prior to our acquisition of them, they generated more revenue, about 20% more revenue than they had in the full year of 2020. Now, the shockwave that's delivered is one that is focused on a particular condition within the animal. It might be a shoulder or an elbow or a knee, It might be a bone that's fractured or an area that is lame. When the shockwave hits that tissue, it provides promotion of new vascularization. It promotes osteogenic or bone regeneration growth and reduces inflammation as well. It's been proven highly effective in multiple clinical studies, something that you see often in the human healthcare market, but is potentially unique in the animal health space in that there are over 40 clinical papers in the equine market alone. And as I mentioned, early adopters have begun to use this technology in small animals and have produced a raft of clinical journal articles about its use in small animals. Now, it hasn't been super well adopted up until now because while the trodes that existed before were ideal for horses, when you used them in small animals, you needed to sedate the dog or the cat for sure. And while that didn't dissuade the early adopters who've written clinical studies about these, it had proven to be an impediment in broad use. So PulseVet developed and launched the X-Trode, which is ideally suited for use in small animals. It no longer requires sedation, which makes it now available to mainstream veterinarians. And recent sales to those small animal vets have certainly validated this opportunity. And it's a significant opportunity. In fact, the market for the small animal applications for shockwave therapy is over 15 times the size of the market for the equine applications. And as I mentioned, now that PulseVet sales team is of only 3, but highly effective 3, has now been augmented by Zomedica's 18-person field sales organization, which we trained literally just this week. And we're launching in 2 weeks at a major veterinarian show. It's not all about small animals. PulseVet had been growing and continues to grow in the equine market as well. First-time purchases by new vets to the therapy, substantial growth. Additional units when you have a really busy practice or a multiple location. These also add to new placements, new sales in the equine market. And this product's been around for 10, 15 years. The ProPulse, which we're selling now, is the 3rd generation generator. Many people are still using the Versatron, which was introduced 10 or 12 years ago. Many others have already upgraded to the new ProPulse, which has certain features that are attractive to the equine vet. Outside the US, with our distribution in place, we have a nice foundation of business, and we've recently added new distributors in both the EU and Russia to begin to sell into new countries outside the US. And beyond the growth in the business from the traditional means, we also are expanding the indications. Exercise-induced pulmonary hemorrhage, or bleeders, is a relatively common condition in horses as they age. It had been thought historically not to be a target for shockwave therapy because it's in the lungs, but recent clinical investigations have demonstrated that it does have applicability there, as does potentially treatment of cysts and benign tumors. So there's opportunity to continue to grow the equine market. But the small animal market is one of the big attractions and why we acquired PulseVet in early October. The passionate early adopters that account among them many of the key opinion leaders in the veterinarian space and small animals, including last year's president of AHA. These folks have generated significant clinical data so that as we go to mainstream veterinarians, it's not a hope and a promise, but rather validated clinical data that we use to demonstrate the benefits of the technology. With the 3 people on the PulseVet sales marketing team, adding to the significant presence of the Zomedica national sales team, which we trained just this week, we are launching jointly at the VMX meeting, which happens the week after next down in Orlando. This market is experiencing significant growth, and it's a much larger market than the equine market. And a number one condition, a number one ailment amongst small animals, in particular dogs, or osteoarthritis, is center of the target for treatment by shockwave therapy. So we're very excited about this opportunity as we move forward. We're also excited about the opportunity to continue to grow our product portfolio. PulseVet was the first of the acquisitions that we expect to have, and we have a really strong balance sheet to be able to do that. We reported as the end of September of last year that we had $271 million in cash. Of course, the next day we acquired PulseVet for almost $72 million. And so you can do the math and see that we had just under $200 million as of October 2nd. We will, of course, be updating this cash position on our 10-K filing as we announce earnings for 2021, and that is expected to occur on February 25th. As I mentioned, PulseVet was the first of the acquisitions that we expect to execute. We're actively pursuing additional products to add to our portfolio, whether they are diagnostic products or whether they are therapeutic products. We have the sales and marketing organization, we believe, with multiple channels to be able to effectively commercialize products in both of these areas. The thing that we want them to have in common is that they represent a standard of care, or at least a potential standard of care. With TRUFORMA, it is a in-house, in-clinic diagnostic product, and in-house diagnostics are becoming standard of care in the vet space. And with PulseVet, it already has proven itself to be essentially the standard of care in equine sports medicine and a couple of other applications. And we believe it has that potential to reach the same standard in small animal vets. The animal health industry is consolidating, and we believe to be part of that. So to recap, we compete in a very large diagnostic market that has significant growth on an ongoing basis. And the driver for that growth, the humanization of pets, shows no sign of abating in the near term. Into this market, we currently are commercializing products that have the potential to drive significant growth in the future. The TRUFORMA device, where we are placing the instrument into the point of care with no upfront capital, foregoes capital revenue, but instead provides us the basis to grow the blade business on an ongoing basis. Highly protected by intellectual property and easily sold and trained into the customer's clinic. PulseVet would be a great opportunity for us to acquire just based on its equine business alone, but also gives us access to the much larger small animal veterinarian business with the launch of the X-Trode and the deployment of our sales organization. Our balance sheet provides us a significant war chest with which to commercialize these products, do the market development necessary to introduce new products into the marketplace, and most importantly, to acquire additional products for our portfolio. Thank you for the opportunity to present, and I would welcome any questions. Feel free to reach out either to Karen Smith at PCG Advisory or directly to us at the company. We're always happy to talk to existing or potential new investors. Thank you.
Thank you, Larry, and I want to thank all of our presenters for taking part in what has been a very productive and informative series of presentations. We appreciate the time and effort that went into preparing them. Hopefully, our next conference will be one we can hold in person rather than virtually. But in the meantime, we're very grateful for your flexibility and your presence online this year. Thank you again from the H.C. Wainwright team.